Welcome back to the Sahara Podcast. As always, I'm your host, Elia Rizvi. In today's episode, we're going to be talking about something that's very important. We're going to be talking about hospice care. For those of you who might not know what hospice care is essentially end-of-life care. It is when a patient or a client gets to the point where, treatment is no longer working or effective, or their illness has gotten to a point where it's terminal and there isn't very much more that can be done. So without further ado, let's introduce you to our guest speaker today so we can talk about this topic more.
Hello, my name is Yusuf Ruhullah. I'm a family physician in the area where I do both outpatient practice, home visits, and hospice care.
All right, well, thank you so much for coming out and doing this podcast with us. I guess the first question that I would have for you, I kind of answered this a little bit already, but what is hospice care and how does it differ from other types of medical care?
Good question. I think you did answer it very well. Hospice care is the end of the spectrum of normal care, where we provide comfort and relief to a patient that is about to pass. Often it's reserved for people who are only within a 6-month or less time frame, and we determine that through a few different metrics and scoring systems. But that essentially is the main difference. We're focused on symptom relief rather than curing the symptoms.
Okay, so when would you say a family should consider hospice care? At what point do you think it's something that should be brought to the table?
Yeah, it's a hard time to. It's a hard decision to make. Mm-hmm. I think one of the main signs is your loved one the same person they were? Even a week ago. Are they kind of at that point where they don't want to keep going? Are they in pain? Are they going back and forth to the hospital often? Is there a revolving discussion on goals of care with the provider? These are all kind of hints towards, hey, maybe we should be considering hospice care. Ultimately, it's up to the patient. It really is. Often patients don't fully understand their disease process. They don't understand that this is not going to get better. And so that discussion needs to be started with the primary, where we discuss, hey, this is the disease, this is what's going on, and this is what we're looking at.
Yeah, but that probably gets tricky, How do you have that conversation with someone that, is your quality of life really like where you want it to be, or is this like an option for you? Because I think that's a very difficult, I would imagine.
Yeah, it is. It really is. Often we base that on trying to subjectify the objective, right? Where we identify parameters where, hey, this is the reality of this disease process. For example, let's take an easy one, cancer. Right. Horrible disease process, and it can really affect not only the patient, but also the family. But at a point, often cancer treatment, especially in elderly, can't go any further because it's causing more problems. The treatment itself is causing more problems, or they're just not eligible for that treatment. So explaining to a family and a patient that, hey, this disease process is taking its toll regardless of what we do. I think it helps kind of bring things into perspective as to what our goals really are. Are we just kind of going to keep going uphill, or are we going to kind of just take it easy and more focused on the symptom relief?
And then I do know that that kind of is the goal, with hospice care, because there comes a point where if it sounds a little harsh to say, but if you aren't going to be able to live much longer, wouldn't you want your last days to be joyful? Wouldn't you want to leave this world relaxed and not, feeling the way you do because of treatment or whatever?
Yeah, absolutely. It's a very challenging time in everybody's life. That's something that pretty much unites all of us, but we're all very afraid of it, and I understand that. From any paradigm you look at it, it's a very difficult discussion and experience. So hospice care tries to find the beauty in that, and tries to help patients through that process and their families through that process.
So I know that you mentioned that hospice care focuses on the quality of life at their end of their life. So essentially, how do they go about doing that versus, curing the illness that the patient has?
Right. All right. So curing an illness requires a lot of time, effort, and sometimes it's not possible, especially when you're dealing with extreme advanced stages of a disease process. So there's a lot of challenges when it comes to treatments, visiting physicians, visiting centers where you have to get that care, whereas hospice care and quality comfort care really just focuses on taking care of a patient in their home setting where they are most comfortable.
So what would you say are some common misconceptions about hospice care? Because not a lot of people know what it is or understand it fully.
Yeah, I think the biggest misconception that people have about hospice care is that we're actively trying to kill somebody. But yeah, it's that's not our goal. It's never our goal in hospice care. Our goal is to allow for a dignified, comfortable passage through death. So that, I would say, is number one. The second one that I often find is that people tend to not accept that this is what's happening. And whether that's so many different reasons, guilt, regrets, just wants to hold on to a loved one or want to hold on to life. It's all understandable.
So here at our agency with home care, we do experience this with our clients as well. Sometimes our clients get to that point where hospice care might be the next step for them, and our caregivers are very involved in our clients' lives. Of course, they're with them, for hours, like almost sometimes every day of the week. And they also have communication with their family. So they have a really good understanding of what's going on inside the home. So I think, caregivers can be an essential person to carry out this conversation, this difficult conversation of hospice care. So how would you say caregivers should go about, maybe not nudging, but bringing up the option of hospice care to the client and the client's family?
Right. I totally agree that caregivers are a crucial role in the patient's care, but they essentially function quite a bit as a family member themselves.
Right.
They've invested not just time, but effort and emotion into taking care of a patient. So it's hard on them as well. I think that the first step is just kind of understanding where they are in the process, where the family members are and where the patient is in regards to their understanding of the disease, as well as their understanding of what's going to happen next, which sometimes could be difficult because they're just not trained to do that.
Right.
So I would recommend when they bring that discussion up is that bring it up very objectively and a step back and saying that, hey, have you or your family considered hospice and maybe shifting our goals of care in a different direction that helps their quality.
And then to add on to that, it's really important that our caregivers communicate this with their supervisors as well. So, if you do notice that, if you think that hospice care might be the next step for your client, if you're concerned about their health and their quality of life, then that's something to bring up to your supervisor, because this is something that should be, communicated with their case manager as well. Because like you said, they're like a family member, but at the same time, you aren't exactly their family member. So it can become like a sticky situation.
It is.
So,
you bring up a wonderful point that sometimes it's not certain people's place to bring that up, right?
Exactly.
So I think it depends on the relationship that you've developed with the family as well as the patient. But I would definitely say take it to someone who can have that conversation more easily.
Right. Yeah. So kind of going off of, talking about family members in terms of a client that may or may not be going to hospice care, how would you say, or what advice would you give to family members of of a patient who is looking towards hospice care on how they can, emotionally prepare for it themselves, because it's difficult for the family members as well as it is for the client?
So that's a tough question. I would say that the first step is just kind of always having an open mind to different forms of medical care. One of the biggest challenges, kind of going back to our previous questions, was accepting that this is what's going on with the family member. And often what happens is people want to continue fighting and pushing forwards, which sometimes is the right course of action. And when you're, as a family member, your goals are to protect and be an advocate to that family member. So I would suggest that the first step is trying to keep an open mind towards various forms of healthcare.
So once a client or a patient is receiving hospice care, the hospice care professionals that are, doing the hospice care, what role do these professionals play in supporting the client and the client's family?
Right. So I think the first step is identifying who we're treating and who we're taking care of, right? Any healthcare professional, the number one goal is to take care of the patient. Mm-hmm. Hospice is slightly different because we also kind of handle the whole situation, right? We provide support to a family member as well as even the caregivers and anybody else involved. Mm-hmm. So I think that the first step is that. Then sending our team out, which is comprised of nursing, home health aides, chaplains, and social workers, as well as a doctor, both in front and behind the scenes, to kind of discuss the various different options of helping the patients out.
So is hospice care only provided in the hospital, or is it something that can be provided at home? And if so, what does that look like?
Yeah, it's an often misconception out there that it can only be done at a certain place. Mm-hmm. It can be done anywhere the patient lives. It could be at home, it could be at a assisted living facility, memory care, at skilled nursing facility, at the hospital. We often prefer to do it at home, but it's up to the patient, it's up to their family, where and how involved they are and how much support they need.
So I know you mentioned, and we talked about how with hospice care, they're looking more towards improving the quality of life for the patient, not so much with the treatment anymore. But then how do hospice care professionals tackle, pain management and symptoms that the patient probably and does still have?
Right. So the four major symptom categories that we take care of are pain, anxiety, shortness of breath, and constipation. Okay. But don't get me wrong, we do other management, but those is really what comes down to often from the medical symptom standpoint of view. So we utilize various pain management techniques. Just starting off with Tylenol and then kind of gradually going up based on their need. Obviously, if certain patients are in a lot of pain, then we adjust accordingly. The higher end of things is where we use morphine, and we discuss that usage carefully and judiciously within the home or even at a facility setting. Other main symptom is shortness of breath. Often a lot of patients are suffering from lung or cardiac diseases at the end stages. So we talk about various methods to reduce and relieve that shortness of breath as well.
So now shifting the focus to our caregivers, what support systems are there for them during this hospice process, right, if there is any for them?
Yeah, totally a good question. So I would say that in general, hospice does not deal with providing support to other members of the healthcare team. We coordinate care quite a bit, but I think that's one of the things that sets Affinity Hospice apart is that we include everybody involved. We provide support to caregivers, to cousins and nephew. That holistic approach where we're taking care of not just this patient, but their family members and their family, and so on, including caregivers. We coordinate a lot with different doctors and different nursing staff, even home health agencies, because, again, a lot of patients' providers become part of their family. And so we want to make sure that everybody is emotionally taken care of.
Yeah, and we see that firsthand here at Sahara. A lot of our caregivers have this deep connection with their clients, and the clients rely on their caregivers a lot. We have situations where a caregiver is, going on vacation or they're leaving and their client doesn't want anyone else.
Yeah.
They're so bonded with their caregiver that they'd rather just not have help, and they just want to wait until they come back because they're so attached to them. So, and that goes both ways, so of course.
No, I think that speaks a lot to the company and the culture developed, and that's something that we're trying to mimic.
Oh, yeah. So then going back to how we spoke about how caregivers become a part of the family, how can caregivers make sure that, the client's loved ones are getting their emotional needs met as well?
Yeah.
It's a lot. It's not their responsibility, but, there are ways that they can, or like things that they should look out for during that hospice care process, when looking at the loved ones of the client that, they could point out or something along those lines.
Yeah, so I think that the first step is always active listening.
Yes.
I think that's huge, where you're just taking it in, understanding where that person's coming from, whether it be a family member or, a sister that hasn't seen the patient in 10 years. There's a lot of emotion coming at approaching death and approaching decline. It's like, why aren't you doing this? Why aren't you doing that? Or you're doing that wrong. You're doing this right. Could do this better. So I think that the caregiver needs to not take it personally sometimes. And it's hard. It's hard because, again, they're a family member, but they're not. So it simplifies things by kind of trying to stay objective and taking a step back and doing active listening and understanding that they're not attacking you, they're not venting at you or about you, but to you. And sometimes that's an important little side piece to really understand.
And I just want to add another note. In these situations, caregivers have to be careful about also not giving too much advice because you're not a medical professional. So if you do notice these things, it's good to be an active listener and to hear what they're saying, but to be objective, like you said. And the best practice, I believe, and what we teach here at Sahara is to always communicate these things with your supervisor. Ask them, what can I do in this situation? How should I tackle this situation? How should I talk to the loved ones of the client? Just the best practice, I think, is to communicate with your supervisor, not give too much advice as well. Yeah,
I'd like to add on that you can always, for mutual patients, you can always feel free to reach out to us too and convey this information that this is what's happening, because I want to make sure that our patients' needs are met, and we're a good source to get that started.
Yeah, so I think that's important for supervisors to keep that in mind, to communicate it with the hospice care providers as well. So I know we touched on this briefly, but how does hospice care work with the client's primary care provider in this whole thing? I know you kind of touched on it a little bit, but is there any other ways that they work with the primary care? Yeah,
so a good question. So often the primary remains our primary, and there's still a good point of contact for the patients. But often at this stage, the primary themselves won't be directing care, so they often defer to us. Now, as a primary care myself, I understand that sometimes I want to be involved in a patient's care, even if they're on hospice with another company or whatever. So it depends on the provider themselves. Some providers just kind of want to let the agency take care of it because they themselves aren't very comfortable dealing with hospice care. But regardless, we try and provide opportunities where they can interact and coordinate care if they'd like, as well as educational points on how what's going on, as well as just updates to the patient's primary care that, hey, this is where the patient's at right now. Or sometimes it happens where we are going to discharge the patient. Can you resume care? So we are in active communication with them.
And I think that's, based off of what we've been talking about, communication is key, during hospice care. So everyone becomes the care team for the client. So it's including you guys, including the caregiver,
Yep.
including the primary care, everyone. So then going more off of talking about communication, can you talk more about the importance of family meetings and communication during this time?
So communication is a big part of any relationship, even more so when we're dealing with death and symptoms and leading up to that dying process. So we at Hospice do family meetings at least every month. More frequent depending on the need. The providers, not only the nursing staff, but also the social worker and the chaplain, as well as the physician, frequently talk with family members to help them throughout this process. We do that both informally and formally. Often the informal ones are the most effective, right? Instead of having a meeting where we all sit down, I think sometimes just touching base with patients and their family members one-on-one, or just with a phone call, really makes a difference in understanding the disease process.
So I'm going to end off this discussion with one final question for you. How can caregivers create meaningful moments with their loved ones that are in hospice care?
So one of the missions at Affinity Hospice is to create meaningful experiences with family as well as anybody involved with the patient. So I would suggest that caregivers listen, participate, and communicate, and focus on what the patient really wants to do. Making sure that you're obviously with the permission of family, but also kind of what the patient is able to do is also an important thing. So consider doing things that makes the patient happier. That often helps create those moments.
So this brings us to the end of this podcast. Thank you for tuning in. And before we close out, again, I would like to reiterate, those of you who have clients that are in hospice care or are nearing, a place in their treatment where you think that hospice care might be the next step, always keep in mind to communicate things with your supervisor. Keep in mind that you are not a medical professional. So, as caregivers, it's important to remember that you are not to give any medical advice. So the key takeaway from this is to maintain communication with your supervisor, and it's important for our supervisors to maintain communication with the care team, with the hospice care providers. So communication is key. Okay, well, thank you again for coming out, taking the time out to come to this podcast and having this meaningful conversation with us.
No, I really appreciate it. It's been great talking about this topic, which is very dear to my heart. We've all experienced this. Unfortunately, we have to experience this. But, you have a friend and a partner that'll help carry you throughout this process at Affinity Hospice. Thank you.